Hello everyone, so this video is a Osce video of gynecology, and in this video I'm going to demonstrate you how to examine the breast. Okay, so hello Miss Leah, this is Dr. Mohit. I'm going to examine your breast today, so is it fine with you? I need your consent and your permission. Okay, I have to make sure that temperature of our room should be adequate. Any of the female's relative or our staff female nurse should be present at the time of the examination. After taking the proper medical history, the family history of the patient, now we are good to go for the breast examination. We have to also know that a breast examination is going to be in two parts. First one is the general inspection, and then we will go for the palpation. Okay, so Tia, now before starting the examination, you have to undress yourself up to the waist. Okay, and put on this towel. Okay, now for the starting of the inspection of the breast, hello Leah, please sit like this. Okay, your hand should be on your thigh or in the relaxed position. Okay, so we have to check, is there any deformities on the breast tissue, or is there any kind of the asymmetry in the breast, is there any kind of the visible or the obvious mass in the breast that's visible in the inspection. Okay, and is there any kind of the scars or any other deformities on the breast. Okay, so now the second position, we have to just instruct Leah, just keep their hands on the their hips and then press the hands like this while we are contracting or tensing the pectoralis muscle. Is there any movable mass present with the pectoralis muscle movements, then it might be a sign of any malignancy. Okay, now there is a third position, and we have to put our hands at the back of our head, and then we have to observe the breast closely. So we have to instruct our patient to lean forward like this, and we have to inspect. We have to observe that all the things which I have already mentioned. After this all inspection completed, now we are good to go for the second step, and that is the palpation step. Our hands should be warm because we are going to do physical touch to the breast of the patient. So we have to make sure first palpate the asymptomatic breast. So now we have to make sure the position of bed should be at 45-degree incline, or we can use the flat bed. Okay, so both hands should be at the back of the head while palpating the breast and the axilla as well. So we have to open the only one side of the breast at a time. Okay, now we will start first our palpation with the nipple examination. So for that we have to press the nipple like this, and we have to observe, is there any kind of the liquid coming out of the nipple, is there any kind of the exudate coming out of the nipple, that these are the signs of any kind of the breast infection. Okay, we are going to use the spiral method for the palpation of this Osce. Okay, we have to observe, is there any kind of the mass, pain or the tenderness. Okay, we have to observe that all things. Okay, so let's get started. We just keep our three fingers like here, and we will start with the areola. We will go spirally down. We have to make sure that we should not leave any place. Now with that we have to also examine the axilla of the patient on the mid axillary line and the posterior axillary line as well. Now we have to cover the first breast, and then we have to go for the other breast examination in the same method. Okay, now after the palpation of the breast, both breasts, now we have to palpate the different lymph nodes. Okay, we have to just palpate the cervical lymph node first, the supraclavicular lymph node means above the clavicle, infraclavicular lymph nodes, and then we will go for the parasternal lymph nodes. Okay, so I have examined a 30 years old Miss Leah, and see, I didn't find out any kind of the deformities, any kind of the asymmetry of the breast. I didn't find out any kind of the scars on the breast or any kind of the visible deformity. I didn't get it. Okay, and now for the palpation part also, I didn't find out any kind of the mass on the breast tissue or the axilla. I have properly palpated the axilla and the lymph nodes as well. Okay, but I didn't find out any kind of the abnormality. So here, this one is the conclusion. She don't have any kind of the infection or any kind of the deformity. So that's it for this Osce video. Thank you so much for watching.